So you've finally been diagnosed with hypermobile Ehlers-Danlos syndrome. What do you do now? Let's talk about it. So I'm always telling people, like, this is what hypermobile Ehlers-Danlos syndrome looks like. This is how you get diagnosed. But I don't ever tell people, like, this is what you do once you're diagnosed. So let's talk about it. So this is what I do. Obviously, you can do whatever you want to do and, you know, do what sounds like is best for you. But in my opinion, this is a good way to go about it. So I think, first off, you obviously need to find a good primary doctor. So it's best to find a primary doctor who works with complex patients. Because if you have hypermobile Ehlers-Danlos syndrome, you're a complex patient. You just are. Okay, give me a second. I'm going to do the bottom part. You can't see it because I'm going to have to flash you for a second. So hold on. So you need to find a primary doctor who works with complex patients. How do you do that? So I recommend finding a primary doctor who either works at like a clinic near like a hospital or a university, like a major clinic that sees patients that have complex issues. If you live in a smaller city, a rural town, that might obviously be a little more difficult. Do the best you can, obviously. Just, talk to other people. I think network, find people with other complex issues who are in your town and find who they're seeing, Just find a doctor who works with complex patients. Patients with, just have complex issues, right? That's just going to be the best bet for you. Hold on, I'm going to grab my tape really quick. Like my primary doctor, he works with complex patients. So he was able to order me like my central lines. I tried to find other primary doctors who were not used to working with complex patients. They were not able to order a central line. They didn't know the first thing about it. Then I found my primary doctor and he's like, oh yeah, I can order a central line. My primary doctor is he's the one who ordered my test. He tested me for antithrombin 3 deficiency. He's the one who figured out my rare genetic blood clotting disorder because he knew to look for that because he works with complex patients. So he knew about that one somehow, he knows about my conditions because he works with patients who have these conditions. So you have to find a doctor who works on these regularly, which can be hard, but once you're diagnosed, you need continuation of care. So you need to find doctors who are familiar with your conditions, which can be hard, obviously. So I know when you're in smaller towns, that can be difficult. So network, find other people who live near you and figure out who they're seeing. And in addition to that, you also need to create a list of all of your issues, all of your problems. And this list can either just be a mental list in your head, or you can literally write it out, whichever works best for you. I just have my list in my head because obviously I could just do a mental check and I know all my things going on, right? And then this list, it needs to be in order of your your most debilitating problem, that is the tippity top, your top priority, all the way to your the thing that can wait, the least, the lowest priority thing at the bottom, right? Whatever you got going on, just order it like that. However many things you got, doesn't matter. It could be 200 things. Put that list either in your head or write it down. So then you have your list and you know what you need to be working on. And then what you're going to do is essentially you're going to start knocking things off that list, but starting with your most debilitating issue, right? And then, knock off other things as you can, of course, as you meet different doctors and things come up, and you can knock things off the list, which is really nice. So, and then as you do that, you'll start gaining a care team, essentially, right? So if your top issue, my top issue right now, for example, is occipital neuralgia. So that forced me, I already had a neurologist, but if I didn't have a neurologist and if my top issue was occipital neuralgia, that would have forced me to find a neurologist, and then I would have found a neurologist for my care team. And then that would have also forced me to find a pain management doctor, because now I'm working with pain management. So then that would have forced me to get a pain management doctor on my team as well. And then also like, you know, next then like I've been choking a lot, like choking on water, like my shower water, and like choking is dangerous. People can, you know, leave this earth from choking. Like it's a serious thing. Like choking's not something to just like put, you know, just not to worry about. Like you can actually not survive from choking, you know, it's dangerous. Especially if you faint, if you know, if you have POTS and things like that, and you fall easily, you know, you can hurt yourself in bad ways. So, anyways, that forced me. Well, I already had an ear, nose, throat doctor, but that would have forced me to find an ear, nose, throat doctor, and then a speech pathologist, you know, to do like a swallowing study, and then also like a esophageal dysmotility, like a upper GI doctor. I hated the upper GI doctor. I guess I'm still kind of working with her, but I don't like her at all. But anyways, I already had an ENT, but then I got a new speech pathologist. I had a speech pathologist that I was working with in 2020, but I haven't seen her in years. And honestly, a new speech pathologist that's closer to me is nice. So I'm happy about that. Okay, hold on a second. But then the other thing, while you're doing this, you also have to be doing physical therapy, okay? You have to be doing physical therapy. I pulse physical therapy. I do physical therapy for a few months, and then I take a few months off. And then I do physical therapy for a few months, and then I take a few months off. I've been doing that just on and off since, I think, 2017. So like almost like 10 years now or so. And then prior to that, you know, I was always, well, in 2017, I was still exercising, but prior to that, I was always exercising. So I've always been doing some sort of physical therapy, but physical therapy, exercise, like some sort of thing to be working your muscles is very necessary. But working with a physical therapist is really great because then you're doing very specific exercises, not even exercises, but just very specific physical therapy that's meant for your body, that's going to make it better and less painful for you to live your life, you know? So pick your most painful body part. So in addition to be like going off your list, whether it's like dysautonomia, GI issues, your nausea, your dizziness and your heart rate, your overactive bladder, and you could be working at like maybe four things or five things at a time, you know, maybe, or 3, 2, whatever. If you're working, you know, maybe one thing at a time, 2 things at a time. If you're like not working like myself, maybe 5 things at a time you can be working on, and then also be doing the physical therapy thing. But whatever you can handle too, like that's a lot of stuff. Like that's obviously, you don't want to get burnt out. You want to take breaks too in between all this. You don't just want to be like at the beginning, like I tried to go ham and like really tried to hit a bunch of stuff, but you want to take breaks. You want to go slow, like just like go and just keep hitting things and know you're going to keep going. You're just always going to have to keep going and keep addressing issues because you're going to have a lot of issues. We have a lot of problems. We got a lot of things. We got a lot of things going on in our body. That's just how our bodies are. So then you're also going to be doing physical therapy. So like if your shoulders are the most painful thing, then go see an orthopedic specialist who specializes in shoulders. Get your, you know, physical therapy from that orthopedic specialist. Get a referral for physical therapy, then do shoulder PT, unless your shoulders are like way too far gone, you need surgery, but even if you need surgery, you still have to do PT. They're still gonna make you do PT. So you're gonna be doing PT. Or maybe it's your hips, or maybe it's your ankles, or your hands, or your back, or your neck, you know, so whatever it is, you're gonna be doing PT. So pulse PT. So find a good primary doctor who works with complex patients, okay? Find a doctor who works with complex patients. Prioritize DES. Make a list of all your issues from worst to least and start knocking off your issues and creating a care team. And then 3, make sure you're pulsing physical therapy. That's what I do. Let me know what questions you have. I love you all. Bye.